Hey everyone, my name is Marc Bates. I'm a metabolic health coach, and this is another in our question and answer series, Rethinking Metabolic Diagnostics Beyond Surface Metrics. Okay, here's the question. This metabolic mirage concept fundamentally challenges how we interpret metabolic health data. Given that lectins can create this disconnect between cellular energy status and blood markers, how should clinicians or anyone restructure their diagnostic approach? What combination of tests and patient observations would give the most accurate picture of someone's true metabolic state when lectin sensitivity is suspected? And this is going to be very important for you. If you're keeping lectins, anything that has lectins in it as part of your diet, you'll want to be able to start recognizing this stuff. Okay? So, that's an outstanding question, though. And yes, the metabolic mirage created by lectin exposure calls for a paradigm shift in how we evaluate metabolic health. The traditional diagnostics often over rely on surface metrics like fasting glucose or A1C, which can look deceptively normal even as tissue level dysfunction quietly worsens. This is one of the issues with metabolic health. Anyways, is that the standard blood tests and labs that most doctors call for and base a lot of their quick observations on are not deep enough. You gotta get a lot deeper than that. Okay, so even these things that look normal, quietly can quietly point out the fact that you are in at tissue level dysfunction, and this will eventually show up quite drastically. To address this, everyone must layer objective biomarkers with functional assessment, a combination of blood work, symptom pattern recognition, challenge testing, and contextual observation. Okay, here we go. Rethinking the diagnostic lens from glucose-centric to function-focused, right? Here's the current model. It's glucose-centric. So if you go to your doctor right now, most of the tests, especially if they're thinking you might have a metabolic issue, they're thinking obesity, they're thinking diabetes, they're thinking stuff like that, right? It's all glucose-centric. They're going to do a fasting glucose test. They're going to do a HbA1c test, right? They're going to do stuff like that. These tests miss early insulin resistance, it doesn't check for that, subcellular energy starvation, it has no way of checking for that, and immune and inflammatory triggers of dysfunction. Patients can appear healthy by lab standards, but still feel fatigued, foggy, and unstable. How many people go to their doctor and say, I just don't feel right, and the doctor really doesn't have anything to give them at that point? Okay? Lectin exposure can create a disconnect between cellular energy status and blood markers, leading to a false sense of metabolic health. So you go to your doctor and say, I'm not feeling right. The doctor asks, are you eating beans? Are you eating wheat? Are you eating anything that has lectin in it, right? They don't know to ask for that as a general rule. They're not trained that way. And that's what it is. So we're looking for a new diagnostic model, a paradigm shift, right? Multi-layered, contextual, and root cause aware. You still do the biochemical testing. Fasting insulin, HOMA-IR, C-peptide, fasting glucose, free fatty acids, beta-hydroxybutyrate, BHP, right? That's ketones. High reactive CRP testing, right? That's inflammation. Reverse C3 zonulin, LPS-DOA, that's leaky gut markers. I suggest all of those in a standard blood test to make sure where you're at. But you also need functional stress tests. You need postprandial insulin challenge. There are different ways of doing this, but you need to measure your glucose and insulin after you eat, not just after a 12-hour fast. Okay, how well are you handling insulin? How well are you working it? Right, disproportionate insulin spikes with flat glucose is an issue that probably is lectin related. Okay, free fatty acids during fasting or exercise. If you're not getting your free fatty acids properly and you're not keto-adapted, there's something wrong. Once again, we look at insulin activity, system pattern inventory, right? Symptoms within 60 to 120 minutes, right? 1 to 2 hours after eating. Fatigue, fog, cravings, anxiety point to a problem. Food-specific triggers, nightshades, legumes, grains, right? Do these things cause you issues that you notice? Once again, that points to something. Energy crashes despite high ketone readings or stable blood sugar. Your energy should not be crashing in this case. That points to something. Patterns of gut symptoms with clean whole food meals. You're eating clean, yet you're still having gut issues. Something's wrong. Okay, and that's something that maybe normal blood markers are just not going to show properly. Okay, so the red flags we're looking at, things like brain fog and stable, while you're still having stable glucose. Well, that's a cellular fuel mismatch. Something's wrong that your brain's not getting the right energy. Low ketones despite fasting. So you block fat oxidation via insulin mimicry, right? Irritability after eating legumes or grains. Well, that's an immune reaction, right? Or a false insulin spike, right? Inconsistent success on keto or carnivore. If you're eating ketogenic, but you're still including some lectin plants, right? Grains, beans, nightshades. Well, and a lot of spices have lectins in them. So go watch the spices. Well, maybe we just need to get rid of those all those suspect veggies, right? Plateaued weight loss with perfect macros, right? Well, that could be adipocyte inflammation, fat cell inflammation from chronic lectin burden, and that may take a long time to get rid of. But these are things to look for, right? There are ways of getting that. Okay, let's talk about putting it all together. Where we go from here. Phase 1, you need to be investigative, right? Run insulin, fasting insulin, CRP, leptin, ketones, FFA, assess, look at food logs, track your energy patterns, right? There are all kinds of things involved in this. And this is where the doctor probably doesn't have enough time, if they're not trained in this, to do this. And the other problem is that most doctors have no way of getting paid for doing this stuff, okay? So you got to watch this. I mean, the doctors have a real place in your health plan, but sometimes it's not in what they're being paid for, okay? Phase 2, eliminate, strict elimination. Definitely eliminate all the lectins, but this is getting rid of the grains, legumes, seeds, nightshades. Optionally, go into a lion diet or a full carnivore diet, right? Basic carnivore. That's the least inflammatory diet you can eat, and it's the best one to figure out what's causing you problems. Monitor. Once you've done the elimination for a while, retest. Look for your insulins, your ketones, your CRP. Are symptoms resolving? Is your energy normalizing? Is the ketones elevated? Yeah, we want to know where you're at, and then reintroduce if you want. Systematically reintroduce small bits of the diet that you want to bring back in, and see how it affects you. Okay, and once again, you don't have to eat carnivore for the rest of your life. It is an elimination diet. And but I'm telling you that depending on how much you have to heal, you may want to be on keto for a long time, if not the rest of your life. Okay, that's an option. So just keep that in mind. Okay, final insight. In lectin-sensitive individuals, true metabolic dysfunction occurs at the intersection of immune activation, receptor mimicry, and cellular fuel confusion, far upstream of what most blood panels detect. So that's the problem here. And once again, your doctor is typically not trained in this area. To diagnose it, clinicians must stop asking what's their blood sugar and start asking, is their energy system actually working? Now, I'm going to put a plug in here. One of my diagnostic tools that I use is something called the Cell Blueprint, which is it's not a blood test or anything. It is a self-assessment, but it looks at how your cell is working. Is it protected? Is the energy correct? Is it getting the right fuel? Right? Is it processing properly? And it's a very good test for that. And so, contact me if you're interested in trying the Cell Blueprint for yourself and seeing what it shows. Okay. So with all of that, thanks for watching. Once again, please, if you haven't done so, please like, subscribe the channel. It helps it a great deal. I would appreciate it. Thank you.